I hate to do this, but hello, everybody. Thank you very much for joining us. I appreciate you taking time today. It's really a pleasure for me to be able to take just a few minutes and kind of give you an update on what's been going on here in Montgomery. We've had so much of our lives disrupted over the past couple of years by COVID, and so many of you have been working so hard. We all have been affected by this disease. We've all known families and loved ones, family members and loved ones that have been touched by this, and many are no longer here with us. And so it looks like perhaps maybe the dawn is breaking just a little bit. We hope that maybe we're starting to get back to normal in just in some sense anyway. There's a lot that we can't predict about COVID, as you know. We are sure there'll be other things for us to deal with in the future. But it is nice to think that maybe we have a break here for at least a little bit, and it's actually really a pleasure to start doing some normal things again, like this broadcast, for example, which we haven't done in a few months. So it's really good to be with you and speak with you for just a few minutes. We actually have started getting out of the office just a little bit. I was able to take a trip this past week to visit some county health departments. We were up in the Northern District last week on Thursday, a week ago from today. We went to Colbert County and Franklin County and Lawrence County, got an opportunity to see the folks who were working there, had really good visits, had good barbecue in Russellville. But it was really nice just to be able to see people face to face again. We're all so used now to being on these Zoom calls and talking on the phone, but not really meeting in person. And so we are gradually getting back to the way things used to be. And I for one, am really glad about that. We're planning to have our district administrator meeting next month, actually in person, which is nice. Our State Committee of Public Health, the board that governs us, actually had a meeting today in person, and we held it in Prattville at the laboratory campus. So we had a very nice meeting this morning at the annex at the training center, and then we were able to take the state committee just right down the road there to the new laboratory facility. And Dr. Massengale and Dr. Williams were able to give a tour for all the state committee members, and it really was just terrific. It was a great event. I think everybody had a lot of fun doing that, and it was just fun, again, to sort of be out doing some things in person. COVID still is somewhat of an issue. You know, we're not seeing as many cases every day as we had been seeing even just a couple of months ago. The pace of the number of deaths that we've seen has slowed considerably, thank goodness. But we still have more than 19,000 Alabamians who've died from this disease, about 19,300, I think, at last count. So it's really wreaked a huge toll on our state, and so we want to be prepared. You know, our goal is to be ready, to be vigilant, to be able to respond again if we have to, but certainly we hope that we don't have to do that. There are many parts of the world and a few parts of this country that are seeing increased cases with this new variant of COVID that's known as BA2. For places in the country or in the world that got really hit hard with the Omicron variant, like we did in Alabama back in December and January, we're not really seeing BA2 very much at this time. And that's because we just had so many people infected in the past 3 months or so that a whole lot of those people still have some immunity on board. They're still protected right now. But we know that immunity that you get from infection tends to wane over time. And we know that we still are a state that has a lot of unvaccinated people. So it's really, again, as I said, just hard to predict the future. We don't know what's going to happen, but we certainly are vulnerable if we get other variants that start popping up. So I would just ask you to, again, remember to be careful. We've seen the case numbers go down so far that we don't have a mask requirement now in our state or in our department. We're very happy about that. I know many of you have expressed to me how happy you are about that. But at the same time, for people who are really vulnerable, people like our seniors, people with chronic health problems, and especially for people who aren't vaccinated, you still really need to be careful. You need to be vigilant. You need to be aware of your surroundings. I will give you one final note about COVID. During the Omicron surge that we've just had in the past couple of months, even though Omicron is less dangerous than some of the strains we saw before, like Delta, we know that people who were unvaccinated during Omicron were over 20 times more likely to die if they got infected than people who were fully vaccinated and boosted. So I know everyone out there is really tired of hearing me talk about vaccinations, but it still remains the single best way to protect yourself against illness or death, and that's the way we also protect the people we're around, our family members, our loved ones, from serious illness or death. So if you haven't gotten vaccinated yet, please do that as soon as possible. If you're vaccinated but not boosted, please do that as soon as you're eligible. There is actually now eligibility for a second booster shot. If you're more than 5 months from your first booster shot, you can obtain a second booster shot as well. So please stay up to date. Please protect yourself and protect those people that you care about. We are winding down the legislative session here in Montgomery. As you know, our legislature comes into session every year in January or February. They have about 30 total meeting days that they have spread out over 3 to 4 months. And today is probably going to be the last day of the session. They actually potentially have one more day they could meet tomorrow. But from everything that we see, it looks like they'll probably adjourn today. That certainly helps us all get back to normal again when they're not here. It takes up so much time and energy to interact with them and follow what's going on. And so it does give us a bit of a breather once they finally adjourn. And so we think that may happen later tonight or no later than tomorrow probably. There are a lot of things going on there. One that everyone will be glad to know is that there has been a 4% pay raise for all state employees. That was passed by the legislature and has already been signed into law by the governor. So congratulations to you. We certainly know that all of our state employees need that and deserve that. And we are glad you're getting that. We wish it could be more, but that'll be coming very soon. And we certainly appreciate the legislature and the governor making that possible for all of our state employees. We have a few bills that we've been tracking and working with here in public health. Probably the one that's most important to us has to do with lead levels in homes. As you know, lead poisoning is still a significant issue, especially for poorer kids, most often African American kids in our state. We have thousands of kids every year with elevated lead levels. We have worked really hard now for 4 straight years trying to strengthen our laws around that and put some teeth into that enforcement. We haven't had any luck so far. There's a chance, a remote chance that we could be successful in that today on what's probably the last day of the session, but just don't know for sure. But we will continue to work on that. We're continuing to try to do our very best to protect our most vulnerable citizens in Alabama, and that includes our children who can be put at risk so much. I had a couple of people that I wanted to mention to you. One is that I had an opportunity a couple of weeks ago to present someone with a 50-year service pin. That was Evelyn Jackson in the Bureau of Vital Statistics. She actually started working for us in 1972 and has 50 years of service. It was very nice to join her and the folks in Vital Stats, and her daughter was there as well, who I got to meet. It was really a fun time, and Evelyn continues to work there. So I hope if you have an opportunity to see her that you'll congratulate her on that. We don't get a lot of chances to pass out 50-year service pins. I'm pretty sure I'm never going to get one of those myself. I also wanted to mention that Dr. Mary McIntyre, our Chief Medical Officer, is going to be retiring at the end of the month. I think most of you know that. She announced that a few months ago. And we had her today on our calls with our district administrators and our statewide staff meeting this morning because those will be the last time that she'll be joining those calls with us. We just want to congratulate Dr. McIntyre for such a great career in public health. She has many years of public health service even before she came to work here at ADPH, but she's retiring as a 25-year employee. We really congratulate her and wish her the best. I know that she's got a lot of great things planned, and I'm sure we will continue to see her and work with her. We're certainly going to miss her. But if you get an opportunity to congratulate Dr. McIntyre, please do that. In the next few weeks, she'll be retiring at the end of April. Starting on May 1st, the Chief Medical Officer role is going to be filled by Dr. Karen Landers. We made that announcement a few weeks ago, and you may have heard that already. But we're very excited that Dr. Landers is going to be coming to Montgomery to assume that responsibility. The CMO role is a really, really big role. It's a really difficult and challenging role that covers many aspects of the department, and we know Dr. Landers is going to do a great job. So we look forward to welcoming her here, and she'll be joining us full-time here in Montgomery to do that. I believe that's all the items that I had to talk to you about today. I think we covered most of the topics and most of the things that are going on. I don't know if we have any questions that were submitted. I don't believe we have. In the absence of that, I just want to take one last second to thank you all for what you do. I appreciate so much all of our staff, all of our employees, everyone who works here in public health has really been a hero throughout the last 2 years in general. But we know that there are many, many more opportunities coming, COVID or not, for us to continue serving our communities, to continue showing compassion and care to our fellow Alabamians. And I just appreciate you all so much. Please accept my thanks from the bottom of my heart for everything that you do. Thanks very much for joining us, and I look forward to talking to you again soon.